Hey, everybody. Woo-wee. What a morning, huh? So, I guess I'm in the IG jail. Okay. I hope everybody is going to see my post on my story on my original account so you all can get on here. We're going to be inviting Dr. Hilu on here in a couple minutes, but I just wanted you guys to all get on here. I'm sorry. Who knew? Who knew? So I guess that means that we are doing incredible things to be locked down for a little bit. But hey, I always say there's more than one way to skin a cat. So let me, I'm going to wait until, welcome. So sorry. So my lives will be directed towards here from now on until they release me from jail, and then we can go back to the other. But I'll still have all my posts. I can still do stories at Andrea .Thompson. But until then, we'll just go this route. My screen is turned sideways, so I'm trying to read. Yes, my screen is. I can't turn it up. It is sideways. Wait, how do I turn my actual screen sideways? How do I do that? I don't know how to do that. Tell me. Thanks for finding a way to do. Yes. If you could tell me. Oh, wait a minute. Let me rotate. Let me see if that works. Nope. That wasn't it. All right. Yes, I know. This is important. It's important to have Dr. Hilu on. It's important what we're going to talk about today. I'm super excited. Had a really nice conversation with him before coming on, and he is so gracious and patient with this process. So thank you, Dr. Hilu, when you come on. Listen, Dr. Raymond Hilu is the leading cellular biologist in the world. He is my partner. He is my doctor. He is my mentor. He is my friend. He has not only helped to save my life, but thousands and thousands, tens of thousands, probably hundreds of thousands at this point, his lives and families, and so many around the world are impacted by him. And so I can't wait to get him on for him to share with you, because there's nothing like hearing directly from the doctor himself, right? All right, so I'm going to wait till he gets on. Good, just keep coming on. And I'm telling you, listen, every time that I speak to Dr. I have to look at this camera right over here so I can see you. Every time I talk with Dr. Hilu, every time we have a conversation or an email or something, I am taking massive notes. So I encourage you to get something to write on, whether it's your tablet, whether it's me. I am old-fashioned. I love to write notes because I know that even today I'll be taking notes, even though I get to hear from him all the time. So I'm trying to see. I'm going to put my glasses on so I don't have to squint. And he is about to come on here in just a couple of minutes. In 2 minutes, I said, "Hey, give me 5 minutes for everybody to come on." And we have a meet and greet in Redding, California on June 3rd. Come, I want to meet you. It's gonna be great. It's gonna be at Aussie's Juicery at 6:30 p.m. So if you are in Redding, if you want to make a trip to Redding, come to my favorite juicery, Aussie's Juice. We're going to have samples, we're going to have juice, we're going to have healthy snacks, and it's just a time for me to get to know you, you to know me on a personal. I love the personal interaction. I mean, I love this, but I also love when we can be in the same place. So I'm going to wait until he gets on here. I'm just going to read this. I'm currently on his plan, and it's been an incredible process. I'm excited. That's so great. That's so wonderful. Congratulations. Yep, Sylvia, you went there. Did you get the Andrea? Oh, man. I tell you, what a morning, huh? This is quite something. All right, I'm just looking to see if he comes on here. I wanted to, we could get things done fast. Thank you to my team. Thank you, Shara. Thank you, Megan. Thank you, everyone, for praying and helping us get on here. Well, you know, if you aren't running into trouble every once in a while and making a stink, then I guess we need to check on ourselves, right? So it's all good. All right. Yep. So let me see if I can get Dr. Hilu. He's going to just request to be on here, and as soon as he requests to be on here, I am going to get him in, and we are going to get started as soon as I see him. I see you joined, Dr. Hilu. I just need you to click the request to come on the live with me. I did Dr. Hilu's cellular blood test last month, and your team helped me so much. You're not healed yet, but making progress. Yes, I say you are healed, and your body's catching up. So we keep going at it. This is okay. Here we go. Let's get him on here. So, health is a journey, folks. All right. Dr. Hilu. Can you hear me?
Yes, perfectly. Can you?
Yes. Did I mention that when you and I really started our relationship together, did I tell you that it would be an adventure?
I expected it to be anyway.
Okay. Well, it's an adventure. So thank you so much, everybody. Wow. Okay. So this is fun. We are slightly behind, but that's okay. We're going to get started. I've already introduced you as from my end, but I would love for those of those that don't know you yet and are just really coming to know who you are through us. Could you just tell them a little bit about yourself and how you got into medicine and how you came into, I love when you talk about the story of being pro the patient and how that got you to where you are now. So I'm going to hand that over to you. Welcome, Dr. Hilu.
Hi, how are you, Andrea? Hi, everybody. Well, it's always been there. I always wanted to be a doctor. As far as I remember, I think I was 7 years old when I was sure that I will be a doctor. My father, in fact, almost became a doctor, but because his dad died, he had to stop his studies and look after his brothers. He had, I don't know, I think he had 24 brothers and sisters.
Wow.
I'm not sure. I don't know all of my uncles. It was a huge family.
Wow.
Very, very, very large family. But that's another story.
Yes.
So he had to interrupt his studies on fourth year of medicine. He was, and so it was his frustration. So he's been always there for me to encourage me. He promised me if that's what I wanted to do, that he would help me, that he would do his best so that I can get to the best universities and so on. And in fact, I got started in the American University of Beirut, that back then, the fees of that university were 6 times the annual salary of my father.
Wow.
And he was the president of the telephone company. So he had a very high salary. His salary was similar to that of the president of the government.
Wow.
And he still couldn't afford to pay my fees. So he had to immigrate to Saudi Arabia to make enough money to pay for my studies. So I was really spoiled in that regard.
Wow.
The thing is that my frustration occurred when I finished my medical studies, because my intention, my idea, my desire was to study medicine so that I can help people heal, cure people. But by the time I finished my studies, I realized that I didn't know how to cure people.
Wow.
I knew how to prescribe drugs. I knew how to carry out some diagnostic things, but not to cure. Didn't know how to heal people. Just maintain help, of course, relief. It was good, but not good enough for me. And that's when I started to travel, investigate, and study different techniques. And this took me all around the world: Russia, United States, Germany. I spent many years here, there, and everywhere, until I felt comfortable enough to start helping people.
Wow.
And the main tool that we use nowadays at our clinics is a microscope, as you know.
Yes.
Because in order to heal, you need to discover what's wrong.
Amen.
If you don't discover what's wrong, you cannot heal. You can help, but you cannot heal. You need to go to the root cause of any symptom, of any disease. And the microscope, the way we use it now, after so many years of experience, is helping us achieve this goal. So people are getting very good results, and we are very, very happy. I'm the first one to feel very satisfied, very happy, very privileged, very blessed to be able to do what I wanted to do. So this is, in short, my little story.
And I am blessed, and I am so happy too, because I mean, not only are you my friend, my mentor, but you are my doctor, and you have helped save my life. So I have so much gratitude to you for that. And you're just an amazing human being on so many levels. And what you pour in your heart, I mean, your heart for people, humanity, for helping, it's just incredible, next to being literally the smartest person on the planet that I personally know, which is good, because I've learned a long time ago that if I have people in my circle that are much, higher intelligence than me, it's really good for me, because then I grow and learn. So thank you very much.
Thank you. I would say the same about you, but it's going to bore everybody. So let's go to
So I am so excited. I mean, it has been such an incredible journey. Since it was interesting when I first sent my blood into you almost 9 years ago now. And then as the years have gone on, and you and I developing a really incredible relationship and partnership, and what we're able to do from Spain to the United States, and the United States to Spain, and actually now all over the world. I mean, it was interesting. We get people coming to us all over. In fact, we were sending the blood kits to Romania the other day, and I'm like, how people are, it's just amazing everywhere, all over. I could name so many places. So it's just so exciting to be, part of this, not just in my own personal healing and in my family, but to come alongside with, thousands of people, and to be able to offer what you have to give in helping people. And I know there's many people on here today listening that are on your protocols and treatment plans and have had their blood analyzed. And so, but today we're talking about something that's really, really important. And you and I have touched on this before, and we're now getting to talk about it in public, with the public, which is, and it's self-diagnosing. And here in the United States, for some reason, we have become experts in self-diagnosing. And I know for you, on a clinical medical side, you have so much to say about this. So I'm going to hand it over to you. And I honestly urge every person that is listening to this to be taking notes, to really listen to what Dr. Hilu has to say, because I think this is really going to impact your life, your health journey, and cause you to start thinking differently and on a different level about this. So.
Right. Well, we've all heard the Latin expression, errare humanum est. We all make mistakes. I mean, to make mistakes is part of the human condition. This applies also to doctors. But when it comes to professional healthcare, when it comes to professional anything, it has a higher impact. Let me start with just a simple example, and this probably would For those who are in a rush and don't want to listen to us, by just listening for the next 15 seconds, it would suffice. If you try to pilot an airplane with 300 passengers with you, and you are not a trained pilot, what are your chances of success in this journey?
Wow.
Almost none. And if you are a pilot, your chances are much, much higher. But 100% does not exist. 100% almost exists if you are not qualified. And that's the example of a pilot.
So good.
Now, the human body is much more sophisticated and complicated. Health is much more difficult than piloting an airplane. So how would anybody, dare to diagnose somebody else and probably kill them? And if you love yourself, how would you dare to do that to yourself? So those who are in a hurry, go and do your business. You don't need to listen to that anymore. In fact, this is what I'm going to base what we are going to talk about.
Oh, so good.
It's so simple. If you are an expert in something, wow, teach me. If you are not, shut up and listen. Yes. And this applies to every single aspect of life. And health is one of the most important aspects of life.
Great.
How would anybody dare to take the chance of self-diagnosing and making mistakes when even qualified doctors make mistakes after training for 15 or 20 years and working for 20 years with patients and a lot of experience, and they still make mistakes?
Yeah.
Much less than those who've never studied medicine or who've never studied the human body. So it's common sense. It's not Dr. Hilu, it's common sense. I mean, just figure it out like this. There are at least 10,000 different diseases that have names.
Wow.
10,000.
Wow.
About 200 mental illnesses that have a specific name to them. Which means that a simple equation would be, go to internet, put symptoms, internet search, and the answer will be, you are probably dying. And this is where everything starts to go wrong. So if you want me to stop here, I do. You ask me some questions, or I'll tell you.
I want you to keep going. I remember even going through physical therapy school, and different classes that we had, like one of a medical disease class, and then you've got this book that's super thick of all, and man, by the time I started reading all that and studying it, I was like, I had self-diagnosed myself. And so I had like so many, I probably had close to 10,000 diseases, and I was dying. But I had to step back and go, whoa, wait a minute. Okay, no, I just need to gather information. But no, I want you to keep going.
Yeah, because self-diagnosis mainly is based not on knowledge, rather on search engines on internet, more than anything else. And search engines are designed in a very specific way. They are designed so that they often provide information on some of the most serious diseases, showcasing the most dangerous ones first. For example, this was a study that was conducted by Microsoft. They found out that when you search symptoms related to headache, symptoms, you get, in the first show-ups, brain tumor. It will be the first thing to appear. And if you search caffeine withdrawal symptoms, they'll be the same ones as the headache, but you wouldn't get brain tumor.
Wow.
Because you are searching a specific thing, although the symptoms are the same ones. So this is the problem. In fact, this study, the one of Microsoft, ended up inventing a new word, which is what applies to what we're talking about. They called it cyberchondria.
Oh, wow.
So it's like cybernetic hypochondriacs. This is what internet is creating. And this emerged in the year 2000. That's 21 years ago.
Wow.
And it's the definition of this term is it's a practice of leaping to conclusions while someone researches health-related matters online. This is the meaning of this beautiful term.
Cyberchondria.
Cyberchondria, yeah. I like this expression because I was looking up some statistics, and that's why I've come across this thing. I'll share some of the statistics with you in a minute about the United States and Europe.
Yes.
For example, if you exhibit depression, many people have some sort of depression and have issues that are related with the lack of sleep. But you do the research on internet, you will end up thinking that you have ADHD, that you have anxiety, that you have you are bipolar, that you have schizophrenia, and so many things start appearing. You get so frightened that you could almost end up having these diseases.
Right.
That you didn't have, especially if you are susceptible, if you are weak, if you're in good shape. So why don't we leave the good thing, the important things, to the ones who know how to do them?
Absolutely.
If we like our car, if we have a beautiful car and we love our car, and there's something probably wrong with the car, we wouldn't dare to fix it if we are not mechanics. We take it to a good mechanic, not to just anyone.
Yeah.
We would research, instead of researching symptoms of the car, we would research best mechanics in the world, because it's our baby car, and we take it there. We wouldn't dare changing pieces and spare parts and pouring different stuffs into that car. How much more important our health is. So search for good doctors, for good practitioners, and get help.
Yes.
If you are stubborn and you want to help yourself, there's one way of doing it. Study medicine.
Yes. There you go. Absolutely.
It's not that difficult. Just take 7 times of your life, and after that, you can do self-diagnosis. I do self-diagnosis for myself. I do it now, not before.
Right, but you're qualified.
Now I think so, but in certain things I'm not qualified. And I have to go to other colleagues and get their help. True. Even when it comes to certain patients, although that's not very common, because as you know, the way we do medicine, we don't really work with diseases. Yes. We don't even work with symptoms. Our case is somehow different. We go behind this. We try to discover what's behind the disease and what's behind the symptoms.
I want you to elaborate on that too.
Yeah, we don't address the diseases and the symptoms unless the person is lying. Okay. We try to work on whatever is wrong, because whatever is wrong on the blood, in this blood smear, under the microscope, whatever is out of balance, if it's not causing a disease right now, it will in the future. So we've got to fix it. Absolutely. We don't care if this person is having a disease or not. Sometimes we get patients getting angry. Oh, you've described that I had 10 different imbalances, but I don't have a single symptom. I feel great. So there must be something wrong. How could I have 10 different wrong things? And it's perfectly normal to have 10 different wrong things, or 3 or 20, and not feel that you have it. Because you have this maybe from the last 2 years, and it hasn't caused a symptom or a disease yet. That's so good. So it's really intelligent to prevent such things that are wrong to end up causing diseases and symptoms. But getting back to the subject we're talking about, once you have a disease, or you think you have a disease, once you get a specific symptom, then I am not the one that can help you, not Dr. Hilu. You need to go to your family doctor if you want the name of the disease. I can't tell you the name of the disease. How can our clinics help you? We study your blood, and tell you what's behind this.
Yes.
What's causing this to you that's happening. But we are not going to tell you, oh, we have discovered in your blood that you have cancer. No. Or we've discovered in your blood that you have headaches. Of course not. I mean, there's not something that looks like a headache that shows under the microscope. But there are things in the blood that can cause headache that we see them under the microscope. Some people would have a headache, others wouldn't have the headache yet. So that's how it goes.
That's so key.
But again, if you want to name, if you want a name, a title, a ticket with the name of your disease, don't Google it. Well, you can Google it if you want to play, but don't take that seriously. Do what you like. I mean, everybody can do whatever they like, but life is too serious to handle such things in such a cheap way.
Yeah.
When it comes to health, I mean, you can. I think statistics can help.
Okay. I'm taking notes.
Yeah. Let's start with the United States.
Yes, let's do.
The percentage of people in the States that try to diagnose their diseases, their symptoms, by just looking at internet. Would you guess what percentage? It's the highest in the world. It is the highest in the world. I'm gonna say
95%.
No, that's not that bad. No, you've gone too high. It's 65%.
65. Oh, so over half.
Over half.
Okay.
And the result of this, the outcome, is that this causes more stress.
Yeah.
Stress from an impending doom. In fact, it makes you start to take ineffective medications or mixing medications in the wrong way. And the best example, we've had it over the last 12 months with the COVID-19. That's what people ended up doing, taking just about anything that they came across. Antiparasitic treatment that cures COVID, I'll take it. High dosages of this, that, and that, I'll take it. Cleaning product that's good for COVID, I'll drink it. I'll use this one. So it can be dangerous. Sometimes it's innocuous, but in many, many cases can be dangerous. Also, incurring in unnecessary costs.
Wow.
When you become what was the word? Cyberchondriac.
Cyber, yes.
When you are cyberchondriac, it's like an addiction. You can't control what you are spending to satisfy this chondria, this imbalance that you have inside yourself. You cannot satisfy yourself very easily. And I wasn't aware of how serious this was until I started to receive the documents from some of our common patients, some of them with 3 pages of supplements.
Yes.
That they take on their own. That they have decided that they have to take. Nobody told them they have to take. A long list of them. And many of them, one cancels the other. So they become like neutralizing each other.
Yes.
And some can even be harmful. Not very often. It's true, we don't want to fool people. In most cases, it's not dangerous to take supplements, but in some cases, it is.
Correct.
It is dangerous, especially if you have specific conditions or if you are pregnant. If you are pregnant, many supplements should go out of the house.
Right.
You have to hide them. Or if you are following some pharmaceutical treatment or hospital treatment or chemotherapy, probably 95% of supplements become contraindicated.
Yeah.
There are hardly any supplements. There are very, very few supplements that are compatible with chemotherapy. But again, there are very few supplements compatible with cancer.
Yeah.
Even if you are not going for chemotherapy, you cannot just take anything. Because there are things that can make your cancer grow faster, natural things.
I remember.
Yeah, sorry, say.
No, I was going to say, I remember when probably so I did my first cellular analysis way back end of 2000 or in 2012 towards the end of there. And I remember I was probably taking 30 different supplements a day. And it's interesting because people will ask me, well, how many supplements do you take now? And I literally may take just a handful of a few things that I need, and that's it.
Hmm.
I mean, but even then it was like, no, we're not taking this, this, and this. This is what your body needs. This is what you've seen. This is what you're saying, that my body needs. And I could remember that shift of when I, took all those out because everybody else is taking it, everybody else, or it's like advertised as this is the latest thing and this is the latest research. And so everybody starts taking it. And I think that in alone is just as medication can be addictive. I think that over supplementing can be an addiction as well.
Exactly so. Exactly so. That's the problem. In fact, I myself, I only take one supplement, but sadly, it doesn't exist in the States. Maybe one day it will. You've seen it, I think, once. It's called Top Telomere Optimization Protocol.
I'm on it every day.
Hide it.
Every day.
Nobody should do it. No. Don't make people keep growing.
Okay, forget nobody saw that.
It's not fair. It's not fair.
I know.
And on the other hand, when internet searchers start putting words to websites and search symptoms, they are not aware that most websites are use mathematical model that's based on page views when determining what order in which to rank pages in each response. And what makes them grow up and appear first are big diseases. So the more they make reference to cancer, the higher they go. Yep. So you have little things and your symptoms say, according to the web page, that you may have cancer, or you may have brain aneurysm risk, or you may have possible hemorrhage, big things. Because if it's going to say that what you have is nothing and it will subside in a few days, then this web page is going to die off. Yes. It's interesting, business-wise.
Yes.
So it's sort of on purpose. It's designed in such a way to frighten people, although the idea is not to frighten. It's just to count a lot, to be served a lot. Go up.
Yeah. And on that note, this is fascinating, but some people are wanting so bad to have a name of a disease. So for what I'm trying to figure out.
Do I have fibromyalgia or is it chronic fatigue syndrome?
You get what I'm saying.
If I were to you, my favorite answer would be, I don't care if it's this or the other.
Yep.
What difference would that make?
Right.
Not at all. There are specific diseases that you need to know the name if you are going to take a specific drug for that. So that you don't go wrong, you need a name of a disease. And if it's some type of cancer, you need even a biopsy if you want to follow a specific chemotherapeutic treatment. But because not all chemotherapy works for all cancers.
Absolutely.
In that case, you do need a name. You need the stage of the disease. You need many, many details. But if you're going to buy supplements, why do you want the name? Why go into that? Why lose your time? Why lose your energy? And going back to errors, I research a lot trying to find or to discover what's the percentage of errors that not doctors, not just plain people, the ones who are not doctors, not professionals, just patients who do research on their own. Mm-hmm. Nothing is published. There are no statistics. So I decided to research the medical misdiagnosis just to give us an idea.
Yes.
So, and this will bring us back to the initial illustration that I started up with.
Okay.
About the pilots.
Yes.
Are there any airplane crashes? Of course there are. And the ones piloting them, aren't they good pilots? Of course they are. But humans make mistakes.
Correct.
But if you are qualified, the mistakes are less in percentage.
Yes.
If all the pilots were not real pilots, then all the airplanes would have disappeared.
Correct.
And the ones traveling on them. That's why there are not so many accidents.
Yep.
And in healthcare, it's somehow similar. But there are more people going to doctors than going on airplanes. So we have much higher figures. And
Yes.
in doctors, World Health Organization, this information is published by World Health Organization. Medical misdiagnosis per year, 138 million.
Wow. Wow.
Out of which 2.6 million end up dying.
Wow.
And these are qualified doctors who misdiagnosed.
Mm.
Would you think that patients who are not doctors that go to the search engines will be better or worse than this?
Yeah, worse than not
Maybe
something.
10 times worse.
Yeah.
So they're playing with fire, really. So
Yeah.
even qualified people can end up misdiagnosing because it's very difficult to put things together and come to a conclusion if you are looking for a title. It is a difficult job. So how would we dare to do it if we are not qualified?
Exactly.
So this is very important. And I looked also at the statistics in the European Union.
Okay.
23% of people are directly affected by a medical error.
Oh.
23%. And by countries, medication errors, Latvia is 32%, Denmark 29%, Poland 28%, Malta 18%. These are official publications.
Wow. Wow.
So in the States, the percentage is not that high. I mean, the figures are very big because many people live there. Mm-hmm. But percentage-wise, it's 1 out of 20 people that have been provided the wrong diagnosis. But that's 12 million Americans. It's a lot in figures, but low in percentage. So we have 12 million misdiagnosed Americans, which is 10% or 5%. I mean, I don't know.
Right.
Depending how you calculate it. More statistics. Do I have anyone here?
Wow.
And one of the major misdiagnoses in the United States are the scans, oncological scans.
Yes. Thank you for talking about this.
That are misinterpreted by general radiologists instead of the subspecialist. So the general radiologist is telling you, you have cancer. Go and get the surgery. And you don't have a cancer. It's a misinterpretation of the scan. And you go and you get the surgery. And you never had cancer in the first place. But again, we're talking about qualified people, people who study, people who are using sophisticated tools and still making mistakes. And then we dare to go and try to do it even better than that. What can be clever or recommendable if you don't trust the initial diagnosis, then go for a second one.
Yes.
Again, there's a statistic on that. The patients who went for a second opinion, they got 66% of their diagnosis redefined.
Wow.
So the ones that who suspected that the diagnosis was not right, they were right. 66% of them. And they got corrected. Wow. Which is not a bad idea.
No, no.
Because before you execute a treatment, why not get a second opinion? Why don't you allow us to look at your blood and help you see what's behind the scenario?
Yes.
Why don't you get as many help as possible? It's your health. It's your life. There's nothing more important.
Yes. Can
So,
I?
please.
So I'm going to use, I mean, this is exactly where I'm at. And I don't mind using me as an example because my life's an open book. um,
That's true.
it,
It is in the book, in fact.
yeah,
Yes.
literally, no pun intended, but it's literally in the book. Um, but that's what, it was like gone recently, and you have been keeping an eye, and I have been keeping an eye on a little lump that I have on the left breast, and went back in for my treatment, maintenance treatments, right, in 2018, 2019, and then all of a sudden it was like got this ultrasound, and now it's like there's cancer, you need surgery, it's this, it's that, yet there's that was the first diagnosis. And I'm so blessed in where I am and what I've learned and working with you and helping. It's like I don't succumb to fear or just those first things. So I know what to do. Well, first of all, I'm not going to self-diagnose, and two, I'm not going to jump on the first opinion, because in reality, it's my person, and I get to ultimately decide what I choose to do. And so, but I choose to partner with you, who can see me at a view that these other doctors haven't been, and then also give me professional advice as to my next steps, which you have given me. And so we're taking those next steps to see, because like I was talking earlier with you off of the live, was that we can always have the surgery, we could never undo it. And we want to make sure. Now, I'm not talking about like life-threatening situations, but I'm talking
That's
about
different.
these type
If
of.
you have a car accident and
Correct.
you have a life-threatening situation, and it's surgery, yes or yes,
Yes,
then it's going to be yes,
I'm not going to say go get a blood analysis first and then we'll talk.
of course, of course.
We're going
No,
to have common
and
sense.
you wouldn't have time to go for a second opinion. If they
That's
have to amputate your leg, then they'll have to amputate it. That's it.
correct. Correct.
That's a different scenario.
Exactly. So we're following, and that's why I so wanted to be on here talking about this, because it's so important, because so many people would have sat in that room like I did, and they would have heard very few things: surgery, cancer, this or that, and not like, I'm not sure, without even taking a look, no buy, nothing. And so I think this is so important. Plus, I want to, okay, you know me, I have to ask before I forget. And I wanted you to touch on this because this is part of self-diagnosing. We also have been very well at diagnosing our friends and our family as well, because we've either gone through something or had a similar label, right, of something, and then that person should follow it. It's been fascinating to me when I first talked about this particular part of the journey of where I'm at now with this, cyst or lump or whatever. I've been talking to people on live, helping to educate them. And I had no problem saying that I had breast implants, back from 1994. Well, instantly, I cannot tell you, hundreds of people message me telling me that my implants is what gave me the cancer in the first place, is what, and you need to get them removed. And every person that now has implants, every person should have their implants removed, because it's been shown that they could cause trouble. Now, I'm not saying there aren't cases where that is the case. But again, here we are, self-diagnosing and diagnosing everybody else to what they should or shouldn't do. Could you talk a little bit about that too? Because it seems like every
Yeah.
person that has something should have the same treatment.
Very interesting that you bring this up, because especially when it comes to cancer, as you know, Andrea, the cause of cancer has not been discovered yet. Why? Because there isn't just one cause.
Yes.
It's a few things. And this is not the complexity of the issue. The complexity of the issue is that these few things in each case can be different.
Yes.
Which makes things even more complicated. There's only one exception, almost exception, and it's lung cancer.
Okay.
Lung cancer, it's known that's caused by tobacco smoking in 99% of the cases. So there's a direct cause. Smoking, lung cancer. What I did, and this will answer your question, about 10 or 15 years ago, and this is my only paper, scientific, medical, published paper.
Yes, yes.
We took 5 cases of lung cancer. The 5 of them were non-smoker. So they were the exception. So the cause was not tobacco smoking. It was something else. The 5 patients that we chose for the study, I had the help of two other colleagues. One of them, you know, Urro, the internist doctor that we have in Andrea. The other one is a neurosurgeon that you don't know him. So we chose the 5 cases to be as similar as possible in order to discover the intersections. Because we thought that this way we'll discover the cause of cancer, of lung cancer, when it's not a smoker, in similar situations. So we took 5 women who had this cancer. They were the same age, 45 years old. They had the same social level, as it were. They ate, their eating habits were very similar. Their sports practice was very similar. Their family life was very similar. So we thought, wow, we are going to get to the root of the problem, why lung cancer appears without tobacco in some cases. To our surprise, they had absolutely nothing in common when we examined them thoroughly.
Wow.
Internally, the causes of cancer in each and every case was completely different. The interesting thing is not only this. The interesting thing is that since the discovery of the imbalances was different in each case, each and every one of them was given a different treatment. They had to follow a different protocol. The 5 cases, according to the oncologists, were classified as uncurable and that they would die within 6 months.
Wow.
There was no solution to them. It was small cell lung carcinoma, unoperable, couldn't be treated with chemotherapy, nor nothing. They had no solution. So it was a real challenge. That's why we were so excited with this study. So they had different treatments. The causes were different, nothing uncommon. So the scientific outcome was 0. I mean, we still say we don't know what caused this, because in her case it was this. In her case it was this, and in her case it was this other things. There were 1 or 2 things in common, but it wasn't the cause, because these 1 or 2 things in common are seen in other diseases where there is no cancer. Again. And the interesting thing that the 5 women that were supposed to be living 6 months, they are still alive.
Wow.
They were all cured by receiving different treatments. So this answers the question.
Yeah.
In a sense. A complicated way of answering it, but you cannot say that breast implants cause breast cancer, because many women that have breast implants don't have breast cancer. Yeah. So it's a lie. Others who have breast implants have breast cancer. Is it one of the risks? Anything is a risk. Yeah. Anything that is strange to the body, that's inside your body, be it drugs, be it unhealthy food, be it anger, be it implants, be it heavy metal, all of these things shouldn't be in the human body. Right. There are too many of these things. In fact, according to my investigation and experience, there are more than 4 things of these in the body that shouldn't be there. The chances that you may get a serious disease start to grow. Okay. But this is not the cause. 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 It's the 4 of them, the 5 of them, 6 of them. Yes. So it's not the implants. It's many things.
Yeah. And I remember, I mean, I asked you point blank, do you think that these implants of mine had caused any of this? And I remember you looked at me, and after you weren't making just a guess. You had looked at everything. We had gone through everything, and you said absolutely not. So it was just fascinating when I got all of these, messages that I need to have this removed, and I'm not a truly into holistic care or whatever you want to call it, because I have implants and I refuse to remove them. I don't deal with those. I just like okay, whatever. Keep moving on, because you're not. But it's just fascinating that we will get a mindset like that when, again, they are not they are not educated, they are not doctors, saying these kinds of things, which can be very dangerous to people, because somebody else could take that and go and feel shame or whatever and go, oh my gosh, I better, do something, and then wind up having some issues. I know I don't want that on me, but I'm really glad you brought that up. Listen, since I'm on a new Instagram and I don't have all the privileges that I do on my other one, I'm limited on time on this one. But with the remaining time, well, one, I wanted to ask if there was anything else you wanted to add to this. And then there's a lot of people on here that they're new to meeting you. They're new to what blood smear analysis is. So very quickly, can you share with them, so that people that do want to get their blood analyzed, they do want to start on a path to health and know what's going on inside, instead of, I'm always about testing, not guessing, and just understanding what you do, because what you bring to this world is so much hope, and not just hope, but real solutions. And you're using advanced and investigative medicine, and you are changing the landscape of health and people and their lives, more than anybody realizes. And so if you have anything else that you want to talk about on the self-diagnosing, but if you can talk a little bit about the analysis, and then we can end.
As you know, my main realm of work, my main implication is in the investigation. I love to discover new things and help other doctors help their patients. Yeah. Because I don't deal directly with patients normally. Most of the time, it's other doctors that deal with the patients. But like we said before, if you want to pilot an airplane, become a pilot. Yeah. If you want to diagnose, become a doctor. Yeah. If you go to a doctor that you don't trust his opinion, his diagnosis, you are in your right not to believe or not to trust that doctor. Then go to another one.
Yes.
And you can even go to a third one in exceptional cases. It's almost impossible by the third one that there would be a misdiagnosis. Almost impossible. And your life is worthy of $1,000 that you have spent on 3 consultations or whatever that would have cost, because we are talking about serious conditions. Now, if you get to us, that's what you wanted me to highlight. What we do is not a first opinion, it's not a second opinion, and it's not a third opinion. We don't do that because we don't dare give diagnosis. What we do, like any other laboratory, a laboratory would examine the blood and send you back the results of this blood, but it won't tell you the disease you have. It's information. It's called assessment or evaluation. It's not a diagnosis. The only difference is that in the labs they give you figures. You have so many red cells, so many white cells, so many platelets. So anybody that reads it, if you see that your red blood cells are very low, you understand that you have anemia, which is a disease. Yeah. So that's a diagnostic based on a paper. But if you look a little bit further and you see that the platelets are very high, then you don't understand what's happening. In reality, if the two things are seen, your problem, your diagnosis is not anemia. So go to the doctor. There's a bleeding somewhere in your body. There can be something wrong in the colon. A doctor has to examine you. So it's a helpful tool to have a blood analysis from a lab. Yes. And to have the right blood analysis, it's not you that has to go to the lab and tell them, I want this to be done. Because you may miss the most important one, and because it's not there, this analysis is useless to a doctor. Let your doctor do it.
It's good.
Share with your doctor your worries. Doc, because of my family history, I'm really worried if I may end up having Alzheimer's. Is there any test that can be done? And he may inform you that, yes, in fact, it does exist from not a long time ago, that you can have such a test. Say, oh, no risk. And then you are relaxed. But the doctor will do it, not internet.
Yes.
Because if you go on internet, you'll immediately think that you are suffering from Alzheimer's already.
Absolutely.
If you
Absolutely
start tracking. Okay, let me continue that. So what we do is not first diagnosis, not first opinion or second or third. We examine the blood like a lab, and instead of sending back a report with amounts, since we don't count the cells under the microscope, we just look at the behavior, more than the behavior, at the shapes. And we stimulate what's on the slides to get different informations, different reactions. We provoke different things to happen on the slide.
So
and
good.
Take note of any abnormality. And what we report back are the abnormalities. Not only the abnormalities, between the parentheses, we put the encyclopedic definition of each and every abnormality. I know that most patients don't even understand the meaning of these terms that we are writing down, like codocytes or spherocytes or colocytes, even though we describe it between parentheses, and they get confused and so on. But we have the obligation, since they are paying for it, to give them the description. Yeah. But if I were a patient, I wouldn't even read this. It's not important. The important bit is what comes afterwards. Because we, as qualified doctors, are the ones that indicate to the patient what to do with this analysis. Yeah. So we tell them, from now on, please do this, do this, do this. Stop doing this, if you were doing it. And take this, take this, take this. And if you are taking that, stop taking it. And that's it. If they trust us, they'll do well. If they don't, they will not do well.
That's true. I tell people that all the time. You can have the best doctor, the best treatment plan, everything. But if you don't trust it, if you fight it, if you don't want to do it, if you don't want to change, it won't work. It doesn't work. So I literally, it's telling me I have just under 2 minutes left. So this is what you get this in the mail, this kit. People ask all the time, why does he only need a few drops of blood? Like they're suspicious. I'm like, well, he's looking you under a microscope, so he only needs a couple drops. It's pretty simple. But you can find these at andreathompson.org. We've also created a free PDF so you can learn more about what's in your blood, how this works. You can go to the HiluInstitute.com. Which is Dr. Hilu's website, and learn so much more. I want to thank you so much for being on here. Thank you for your patience with, I'm in Instagram jail, but hopefully I'll get out soon. But hey, we did it. We accomplished it. And so I know this was so helpful. Thank you so much for being on here. I love you so much. I appreciate you. Can't wait for you to come here, and I can't wait to go there. And at some point, it'll all happen. We're going to save this on my IGTV. It'll also be on my YouTube channel. And if you have any questions, you can contact us at info@andreathompson.org. Too many Andrea Thompsons. I can't keep track. But our team will help you in any way.
I'm sure one way or another we will meet in a few weeks. Let's not say how many, but
that's right. We'll just say, that's right. We will. All right. Thank you so much, everybody, for being on here. I'm going to end this so that we can save it. Love you all. Love you, Dr. Hilu. Talk to you all soon. Bye-bye.
Likewise. Bye-bye. Bye, everyone.